Hello, I'm Dr. Robin Lee of Bay Area Foot and Ankle Associates, and today I'm going to talk about early recognition and prevention of diabetic foot problems, essentially basic prevention of amputation. Very quickly, my background, I graduated from podiatry school in 1998, finished my residency in 2000, and I am a certified wound specialist physician by the American Board of Wound Management. As most people know, diabetes is a growing problem in this population. Approximately 5% of Americans will develop diabetes in their lifetime. And essentially, diabetics have a 15 times greater risk of amputation than a non-diabetic. What leads to this increased risk in amputation is that most diabetics will develop some form of neuropathy in their lifetime. In addition, most or a good proportion of diabetics will also develop some form of poor circulation in their lifetime. So the neuropathy or nerve damage leads to loss of feeling, and this results in a lack of recognition by the patient of the presence of a wound or infection. The poor circulation, we call it angiopathy, results in poor wound healing potential. In addition, elevated blood sugars will also result in poor wound healing potential and a decreased ability to fight infection. And the presence of a foot deformity will also predispose the patient to developing some sort of wound in their foot due to irritation of the skin by ill-fitting shoes. It should be noted that some diabetics never develop the neuropathy or nerve damage, the angiopathy or poor circulation. They keep their blood sugar under good control and they have normal looking feet, and therefore they have a very low amputation risk, which is close to that of a non-diabetic. And conversely, in my practice, I have seen patients who are not diabetic, but they, for whatever reason, have the neuropathy, the poor circulation, poor and are immune compromised, usually from organ transplant status, and may have foot deformities, and therefore these patients are also classified as having a high amputation risk. So why does a foot end up being amputated? The amputation is usually the end result of a wound or an infection. So the wound can start off as a cut, blister, a thick callus, or a burn wound. And the infection can be a result of a insect bite, needle puncture, ingrown toenail, or cellulitis. So an infection may not have an obvious wound or portal of entry. Amputation of the foot can also result from sudden loss of circulation. This can happen internally from a patient throwing a blood clot to one of the vessels that provide circulation to the toes. It can also happen with vasospastic conditions. Most common one is frostbite. And also externally, the circulation can be compromised. There's been cases where a podiatrist forgot to remove the tourniquet from a toe after a ingrown nail procedure, and that resulted in the toe being amputated. In addition, any kind of excess pressure can compromise the circulation. The most common form of this is a bed sore where there's just too much pressure on the skin, and that impedes the ability of blood to get to that section of skin, and resulting in a ulcer. So to prevent amputations, proper foot care and early recognition of problems, especially for those with neuropathy or poor circulation, is extremely important. Essentially, we want the patient to be able to monitor for signs of infection and injury. Essentially, the patient should be able to inspect his or her feet for redness, swelling, drainage, bleeding, any color changes, or odor. And we'll go through some examples of this. So again, the patient should monitor for signs of infection and injury. A common sign is localized redness, and this can indicate most commonly infection. And notice on these pictures here are localized infection from an infected ingrown toenail. Also here's some redness from an insect bite. Um, Redness can also indicate a injury as far as like a sprain or a fracture. Usually it's more mild and not as warm. Red streaking is a sign of an infection spreading and should be treated as soon as possible. It's a sign that the patient is starting to possibly get blood poisoning. Swelling, localized swelling, is also a sign of injury or infection. What the patient wants to look for is any kind of loss of skin wrinkling and the disappearance of tendons. So on this right foot, you can no longer visualize the extensor tendons to the toes, which you can see on this left foot. The patient should also monitor for any other color changes. Another color change that is similar is redness, but redness that is associated with a cold foot. And this is indicative of a foot with a poor circulation or peripheral vascular disease. So typically this foot will feel cold and typically will be more red when the foot is lowered as opposed to elevated. And typically this type of foot will become pale when elevated. Other color changes to monitor is any kind of purple, blue, or pale or black discoloration. This is another sign of poor circulation, especially if it's associated with a colder foot or toe. This kind of splotchy discoloration here can be an early sign of a patient throwing some blood clots down into their foot, which can eventually completely cut off the circulation, resulting in a shriveled up black toe. Other color changes to look out for are any color changes within the nail or callus, particularly a red, purple, blue, or black discoloration. This typically suggests some sort of underlying bleeding or ulceration. So in this case, a bruised toenail where there was bleeding underneath the nail, or what looks like bruising of a corn or callus, but that typically means that the skin underneath the callus has actually been broken and is bleeding a little bit. Again, can be a start of a diabetic ulcer, and also the cause of this damage needs to be addressed so it can be prevented. So checking the patients to make sure their shoes are properly fitting, asking them about their activity. Oftentimes, if they're doing too much walking, something like this can develop. And also assessing to see if they have any foot deformities. So the callus at the tip of the toe that becomes an ulcer is very common with those with hammer toe deformities. Also, the at-risk patient should check for any new calluses or corns. This can be a sign of neuropathy or loss of feeling, especially if these calluses or corns are reported as being non-tender. When they tell me that it doesn't bother them, this suggests that they may be losing feeling in their feet, which would increase their amputation risk. Other things to check for is for any presence of any blisters. These blisters may have an underlying ulcer or may develop later to a foot ulcer if left unaddressed. Also, the presence of a blister, especially if it is non-tender, not painful, is a sign of the patient developing neuropathy or loss of feeling. The patient should also check for any signs of discoloration that is blue or purple that's associated with swelling. This usually is due to bruise or contusion, and in my patients with loss of feeling, sometimes they don't recall any specific trauma, but this bruising can be a sign of a hematoma, essentially internal bleeding. This can result from, again, a blunt trauma or from spraining the foot or a fracture of the foot. My patients take a bad step and have this develop. What's worrisome is that the bruising or the hematoma can develop into an abscess or pus pocket, and this may require incision and drainage and antibiotics to resolve. A common scenario is a patient dropping a can on top of their foot, resulting in bruising and the hematoma formation as far as the pooling of blood. They wait around a few days to see if it'll go down, but unfortunately the bruising and swelling stays the same or actually seems to get worse, and by the time they present to the doctor, the area needs to be incised open to drain out the blood and sometimes the associated pus, and then the patient needs the wound packed and usually needs a course of antibiotics. So for amputation prevention, it's very important for the patient to check for signs of infection or injury. Other things to look for is any new onset foot pain. The patient should also check their socks for any kind of blood or drainage would indicate a wound or possibly a blister, especially if they're not able to visually inspect their foot completely. Another sign of something wrong with their foot is their foot not fitting in their shoes or the shoes suddenly fitting very tight. Again, this is an obvious sign of swelling in the foot. and something is brewing, either an infection or injury. Other signs of infection include the blood sugar being suddenly elevated. The patient tells me that, yeah, normally their blood sugar is 150 in the morning, and lately it's been in the 200s. That's a sign that something's happening, typically an infection. Also, the patient relating that they're just not feeling themselves can indicate some infection brewing. So, typical signs of infection systemically include fever, nausea, vomiting, chills, and night sweats. Some other recommendations for amputation prevention for my diabetic patients or higher risk patients include avoid walking barefoot. I know a lot of patients want to walk around barefoot inside the house. I request that they at least wear sandals around the house. I have the patients check their shoes for any foreign objects. I've had a few patients develop foot ulcerations when usually their grandchildren left behind a small toy like a Hot Wheels car or coins in their shoe. And because they have a loss of feeling, they were unable to notice that something was wrong. I recommend that the high-risk diabetic patients get professional care for their nail trimming, as well as the trimming of any kind of corns or calluses. Also, the diabetic or high-risk amputation patient should avoid use of over-the-counter callus-removing products. Most of these products contain salicylic acid, which is designed to chemically burn layers of the dead skin or callus tissue. However, this acid doesn't differentiate between dead skin and live skin. And for some of my patients with loss of feeling, they can overuse the product and develop a wound ulceration. This concludes my presentation on early recognition and prevention of diabetic foot problems. I hope this information was helpful. Thank you for your time and attention, and go make today a great day.